Hello everyone, my name is Saroj Bangade. Today date is 25, 25 March 2022. Uh, Today video topic is the antibiotic. So what so this, what is the antibiotic? Antibiotic is the antibiosis, meaning against the life. The substance derived from the microorganism or product synthetically to the kill or suppress the growth of the other microorganism. Though so the classification so next is the classification of the antibiotic. The antibiotic are the classified by the several way. First is the on the basis of the mechanism of action, on the basis of the spectrum of activity, on the basis of the mode of the action. So next is the on the basis of the so next is the mechanism of action of the antimicrobial agent. First is the inhibition of the cell wall synthesis. There are the four type of antibiotic. First is the penicillin. Second is a cephalosporin. Third is a bactericin, and fourth is a vancomycin. Second is the inhibition of the function. Second is the inhibition of the function of the cellular membrane. Included are the one antibiotic. There are the polymyxin. Third is the inhibition of the protein synthesis. Included are the chlorophenol, microlide, clindamycin, and tetracycline and aminoglycoside. Fourth is the inhibition of the nucleic acid synthesis. There are the first is the clunonine, and second is the diphenhydramine. Fifth is the inhibition of the folic acid synthesis. There are the included in the one antibiotic. First is the sulfonamide and trimethoprim. So next is the basis on the cell wall synthesis and antimicrobial spectrum. Antimicrobial spectrum, the scope of the drug kill or suppress the growth of microorganism. First is the narrow spectrum, second is the broad spectrum. Narrow spectrum is the drug that only act on the one kind of the one strain of bacteria. Broad spectrum is the drug that have a wide antimicrobial scope. So next is on the basis of the mode of the action. First is the bacteriostatic antibiotic. There are the included are the four type of the antibiotic. First is the tetracycline. Second is the chloramfenicol. Third is the erythromycin, and fourth is the linomycin. The next one is the bactericidal antibiotic included in the cephalosporin, penicillin, erythromycin, aminoglycoside, and contrimazole. So next is the antibiotic resistant and antibiotic resistant. Antibiotic resistant is the phenomenon that the subsequently of the pathogenic microorganism to antibiotic become a pathogenic microorganism to the antibiotic become a lower or even loses after the microorganism contact with the antibiotic many times. So next is the mechanism of so next is the classification of the antibiotic. The main classes of the antibiotic are the first is the beta galactine, penicillin, cephalosporin, carbapenem, Monacobacter, microlides and ketolides, aminoglycide, fluoronoside, tetracycline, and aminofolcol. First is a penicillin. The penicillin are the older class of the antibiotic. Penicillin have a common chemical structure which they share with the cephalosporin. The penicillin are generally bactericidal, inhibiting the formation of the cell wall. Penicillin are used to treat the skin infection, dental infection, ear infection, respiratory tract infection, urinary tract infection, and gonorrhea. So type of penicillin. For the first is a natural penicillin, the penicillin G. Second is the pelicinase resistant penicillins, methelacin and oxalacin. Third is the aminopenicillin, amipenicillin and amaxopenicillin. So next is the cephalosporins. Cephalosporin have a mechanism action of the identical to that of the penicillin. Interference with the synthesis of the bacterial cell wall, and so are the bactericidal. Cephalosporin are used to the treatment of pneumonia, strep throat, strep infection, tonsil, bronchitis, otitis media, various type of the skin infection, gonorrhea, urinary tract infection. Cephalosporin antibiotic are commonly used to the surgical prophylaxis. Cephaloxin can be used to the treat the bone infection. So next is a next is a carbophenum. A class of the B-lactam antibiotic with the broad spectrum antibacterial activity, highly resistant to most the B-lactamous. Active agent both gram positive and gram negative bacteria, and anaerobe with the exception of the intracellular such as the chlamydia. So adverse effect of the carbonapinum include the headache, rash, upset, hypertension with the renal dysfunction. So next is the monobactam. They are the B-lactam compound. They work against only the aerobic gram negative bacteria, and the only commercial available the monobactam antibiotic is the heterozoum. Adverse effect to the monobactam can include the skin rashes and the abnormal liver function. So next is the microlids. Microlids are the bacteriostatic binding with the bacterial ribosome to inhibit the protein synthesis. So microlid antibiotics are used to the treatment of the respiratory tract infection such as the stenops and genital and skin infection. So next is a ketolid. Antibiotic belong to the microlids group, much broad spectrum than other microlid. Ketolid are effective against the microlid resistant bacteria due to the ability to bind at the two site at the bacterial ribosome, as well as having a structural modification to make the spore subtract for the mediated resistance. So next is the aminoglycidid. The aminoglycidid are the bacterial and work by the stopping bacterium from the making the protein. Aminoglycidid antibiotic are used to treat the infection caused by the gram negative bacteria aminoglycidate may be used along with the penicillin or the cephalosporin to give the two group attack on the bacteria. So next is fluoroquinolones. They are the synthesis antibiotic not derived from the bacteria. Fluoroquinolones are based on the spectrum bactericidal group, are the chemically unrelated to the penicillin of the cephalosporin. Fluorochlorine inhibit the bacterial by the interfering with the ability to make the DNA. This is the bactericidal. Next is a tetracycline, broad spectrum bacteriostatic agent and work by the inhibiting the bacterial protein synthesis. Tetracycline may be effective against a wide variety of the microorganism, including the rickettsia and amoebic parasite. Tetracycline are used to the treatment of the infection of the respiratory tract, middle ear, urinary tract, and skin infection. So tetracycline also used the treat the gonorrhea, rocky monster, spotted fever, etc. So next is a chlorophenicol. It is a bacteriostatic. It is a considered the prototypical broad spectrum antibiotic alongside alongside the tetracycline. Is the both it is a both cheap and easy to manufacture. It is a frequently an antibiotic of choice in the developing world, effective against a wide variety of the gram positive and gram negative bacteria, including the most anaerobic organism. So next is a next is a streptogramcin, effective in the treatment of the Venetian resistant the Staphylococcus aureus and the Venio resistant of the two most rapidly growing strain in multi-drug resistant bacteria. The next is a glycopeptide antibiotic. Member of the group may be used for the treating methicillin resistant Staphylococcus aureus infection, complicated skin infection, difficilitated diarrhea, and intercoccal infections such as the endocarditis, which are the resistant to the beta lactam and other antibiotic. Next is the aminoglycoside. Aminoglycoside inhibit the bacterial synthesis binding to the 30S ribosome and act rapidly bacterial antibiotic. This group are usually given the intravenously, inhale and of the ophthalmic dose from the are also available. Next is a carbonophenum. This is the injectable beta-lactam antibiotic, have a wide spectrum of bacteria killing power and may be used for the moderate to life-threatening bacterial infection like stomach infection, kidney infection, multi-drug resistant hospital acquired infection, and many other type of the serious bacterial illness. This is the classification of the antibiotic. Thank you.